Hi, Joa. Welcome to FlowFest 2023.
Thank you, Fabio. I was super excited and happy when you extended that invitation. Very happy to be here. Thank you for the invitation.
We are very happy to have you here. I mean, we are really excited. I'm really excited to hear what you're going to talk about today. Yeah, I mean, we have, as you see, we have Digital Workforce here today, our technology partner, but also customer. So we have actually a double role here representing us today at FlowFest. And Digital Workforce is one of our strategic partners in the Nordics. So, and we are really happy to have them presenting here at FlowFest. I think today Juha will present about a really an exciting use case. I mean, Age already mentioned it also before and during his keynote, right? It's about elevating cancer care follow-up. I mean, really in the Nordic University Hospital. So it's really great to, I mean, I really want to see what you're going to talk about, Juha. Juha is the global head of healthcare, so a very exciting person here. I mean, really showing us a different thing, and is joining us from Finland. Yeah, maybe for the audience, I mean, you have the possibility to ask questions throughout the whole presentation. Feel free to do that, right? I mean, you have on the site, you have a text box where you can actually ask questions all the time. And you also have the possibility on the bottom to scan a QR code in case you want to go in full screen mode, because then you can actually ask the questions through mobile. Yeah, I mean, we will address all questions at the end, but yeah, I think I don't want to spend too much time because today is your show, Juha, so I'm passing over to you.
Thank you, Fabio. As I said, I'm super excited to be here to share something we've done over the course of the few months. As Fabio said, we're talking about cancer survivorship care, cancer follow-up, a path to transformation. It's a super exciting story. But before jumping into the project, so as Fabio kindly introduced our company, and myself, my name is Juha, I'm leading the healthcare practice here at Digital Workforce. We are a company based out of Helsinki, Finland, where I am at the moment as well. But today we have over 200 people across the Western world, so to say, 11 offices, 200 large global customers. We went public a few years ago, and we've been recognized as the global leader in vision, our innovation roadmap, and digital transformation. I guess that's what we're talking about here today. We have the well-recognized ICO certificates in the risk management, service management side, and what we really see where our value added comes from is the strong industry expertise. So we're a service company. So with help of our consultants, we can really truly transform the way our clients are working in the future. I'm representing the healthcare vertical, but we also have other verticals in finance, public sector, and manufacturing, where we can really help our clients to transfer the way of working and yield additional business benefits. As Fabio mentioned as well, so Flowable is one of our main partners, core partners in today's state, and actually Flowable's the capabilities that you guys bring into the game are the reason that we were able to accomplish this. I will talk more about that later in the presentation, but that was really a game changer for us. As a company, we're an automation service provider. So we have a long history with the industry-leading commercial technologies such as Blueprint and UiPath and Microsoft. We work with a large number of global clients. What comes to the healthcare, unfortunately, there would be such an interesting logos here. Unfortunately, we're not able to disclose them, but especially in the US, we work with the leading hospitals that you can see in the Newsweek top list in the very top portion of that list. But since this presentation is not about our company, but what we do in healthcare, and more specifically how we're helping our clients. So let's first very quickly go through that. How do we actually help our healthcare clients? So there are like sort of like 4 domains where we operate and where we see we're helping our clients in today's state. First of all, this is something we're talking about today. So something we label as operational efficiency. It means that something where we help our healthcare clients to be more operationally proficient, faster, more efficient. In the end, it's all about supporting the highly skilled but busy clinicians, and that's what we're talking about here today. This is by far our largest domain, and this is where we really help our clients, their core operations, and in the end, it's all about the patient. So that's what we want to enable. Then we have something we call management support. This is also something where Flowable has been a great asset. It has to do with the reporting or enabling management decision making. Oftentimes data is scattered, especially in the healthcare, across different systems, and really getting sort of like holistic view of what's going on in order to drive insights, take decisions. It's actually quite hard for our clients in today's state where they have many different, often legacy systems. So that's where Flowable has provided great support, and that's also something that we're going to discuss a bit more in our case example today. Integration capability, a very traditional use case for RPA and automation, but this is also something that we're doing in the UK for one of our NHS clients. So together with RPA and Flowable, we are building an integration capability in between something new they acquired and then between to the legacy old EMR system, which didn't unfortunately provide any of the modern APIs or other connectivity capabilities. So we used RPA on that. A good example that case itself would be a good candidate for another presentation maybe in the future. And then a very transactional but highly requested service in today's state when there's a need to kick off, deploy new systems. Hospitals never stop. So in order to continue the care of the patients, for the patient safety's sake, it's really important that the data migration between the legacy system and the new system to be deployed is fast, efficient, and reliable. So that's also something we do quite a bit, but this is more of the traditional transactional services, whereas the three first domains I introduced are more of what we do today, especially supported by Flowable. But let's move forward. So let's look at some of the macro trends impacting where we are today and why our clients in the end approach us. So we all still remember the COVID pandemic very well. In today's case, what we're talking about, the pandemic caused care backlog of that some of the appointments for the cancer care are 9 to 10 months delayed. So there's a huge gap between the initial diagnostic test and then seeing a meeting with the clinician. So that's something that's really impacting, still impacting many of the providers, especially in countries where there's public healthcare system. Then the ever-rising costs of healthcare. We know people live longer. We can treat diseases, conditions that we were not able to do so 5-10 years ago even, but it's just going to cost more money. So what we're aiming to do here as well is to, if not stop the growth of the cost, or at least limit that to some extent. We all know very well in the Western countries that, especially in the Western countries, that the aging population puts and is going to put more burden on the healthcare system. Whereas it's wonderful that people live longer, associated also with the ever-rising cost, that this puts so much pressure, financial pressure, also finding and retaining workers pressure, sort of like skilled workforce pressure on the system. So there's less skilled people to treat an ever-increasing number of patients. So what I'm trying to say here, that one of the drivers here is that there needs to be new, better, and more efficient ways of doing the things differently than we did them in the past. And then what is more specific in the cancer care is that more and more cancers are detected in recent years. That's because of that we have better diagnostic, which is wonderful. There are also lifestyle and quality questions that tend to the fact that there are more cancers detected, And also the simple fact that people live longer. All these things combined lead to the fact that more and more cancer detected in recent years. And that brings us to today's theme, together with these other larger trends that I introduced here. So to move forward into the more concrete, so what are we really talking about? So let's first define what we're talking about. So cancer follow-up or cancer survivorship refers to an ongoing medical care and monitoring that a person receives after completing the primary cancer treatment. It could be surgical, it could be something else, but in any way, its primary objective is to monitor for possible recurrence. And that's what we're talking about here. Cancer survivorship care also includes many other topics, such as health promotion, lifestyle related questions. But now today we're talking mainly about the monitoring for the possible recurrence, which is probably the most important topic in that domain. So from a patient perspective, a little bit to start talking about the problem statement here, that every patient, so our university hospital, their patient base only for breast cancer, what we're talking about here today, is 6,000 patients. So every patient goes through an annual or biannual cycle, which means that they go through a process with 10 to 14 steps. One cycle should actually last 1 to 2 calendar months. I will tell you more about that in a bit. But as I said, some of the appointments are so heavily delayed that one cycle is actually could be up to a year. So this is something that really wanted to change. It should just take a month or 2 months max, something along those lines. Towards the end of the presentation, we'll talk about the KPIs and numbers. How are they going to measure the success? But there are several KPIs that have taken significant downturn, and our client, as I said, leading university hospital, decided to approach this very differently. And that's why they decided to implement several updates in their clinical protocols, which required something that we are doing together with the client. So client wanted to pursue this transformation with our company, and we're obviously extremely happy about that. A leading organization in Nordic or in the Nordics, in Northern Europe. So we're extremely happy and proud about that opportunity. So what we're actually doing here is that the basis was that there's nothing that's readily available. This client is using sort of like best of breed EMR system, full stack install, but yet it really doesn't support this kind of transformations, and that's how we got into the picture. What we're aiming to do is that the whole management and execution of the cancer surveillance will be fully automated for the 5-year period. This will assure that the clinicians have less manual work to do, and the patients, in the end, this is something we're doing for the patients, that they will get consistent quality of the care according to the defined protocol. So we know it's going to happen as it should, and that's something that they don't know today, since everything is mainly, if not entirely manual. What it also enables is that they can change the way of working, and this is actually something we're doing. Instead of the old one way of doing things, they will implement new clinical protocols, a way of working that allows patients to have a say that how they want their condition to be treated, followed up. Do they want to meet the clinicians, or do they just want to be informed if everything is okay? So this project is opening up new opportunities that how patients will perceive and receive their care. Also engaging the patients more, and also aiming to improve the patient satisfaction. To summarize the benefits, what we're seeing here, or aiming to materialize, are the patient safety, consistent way of working throughout the cycle, so to say. Transparency of the monitoring. This is something we talked a bit in the previous slide, that they actually know what's going on and where, so they can actually see if some things require actions from the management. That's not something they have access to, that kind of data in today's day. So that's a big benefit for them. And then in the end, elimination of manual human resources, where the solution applies. We'll talk more about that, but they have really high hopes, and we are very sure it's going to materialize as well. So let's see what we're actually talking about. So we're talking about the high-level solution overview. So from full management to automation. So if we look at the components that we have here, so in the middle, you have something that we've framed or labeled as the cancer care follow-up automation and management. This is actually Flowable. So this is the core of the solution. So this core of the solution actually knows which patients are subject to their breast cancer follow-up, for example. So this happens for every patient every year. So this is the core that tells the latter part of the solution. I'll explain those more in details in a bit, that really control and manages, orchestrates everything that what's happening. And as an RPA company, this is something that we couldn't really do before. So this is where Flowable comes into the picture. So our automation capabilities, it could be RPA or even APIs at some point, they're in an executional role. And whereas the Flowable, now labeled as the cancer care follow-up automation and management piece, is actually something that orchestrates and make sure that the entire cycle happens when it should. And when this happens across the patient base, which is 6,000 people, we are actually going to see a huge leapfrog of how the KPIs are likely to be improved. This is something that I didn't say, so it's a bit of unfortunate that we were supposed to be live or deployed by the time of this event, but there were some third-party dependencies that unfortunately pushed back the implementation by a few months, but it's going to happen early next year. So the cancer care follow-up automation management makes sure that everything happens as it should. Then on the right-hand side, we have the EMR system. So it's worth of mentioning that we are not trying to recreate another EMR system, but that's the source of truth and where other things happen. But there's an ongoing communication between the Flowable component and the EMR. Then we have the clinicians. They still have their role, but they are only focusing on things that really require their supervision. And then they use the tool for reporting purposes as well. And then we have, of course, the patients in the middle. And then we'll see what pieces are missing from this equation. So Flowable, orchestrating the whole setup, letting the patient know when it's time to go to the diagnostic test. So that's an X-ray, basically. Patient is told to go to the X-ray. They will actually use a patient portal or an SMS system to book their preferred time and place for that test. And of course, our solution oversees that the patient attends the test. So we'll send them reminders and whatnot if they haven't done so. Obviously, we can force the patient to go to the test. So there's of course limitations, but we'll make sure to our utmost that we actually make sure that the patient is reminded enough that they go to the test. Once the test has been taken, the test result will be read by the physician, and we are then sort of like reading or interpreting the result, and then letting the patient know if the result is neutral. And that's where the beauty is. Let's talk about the KPIs in a bit, but around 80% of the people should come back with a neutral result. So how things are actually changing, that everything here that you see 1, 2, 3, 4, 5, 6, 7, whatnot, except for the patient piece, has been purely manual. So someone from that cancer care department manually starts from identifying the patients all the way letting the patients know that now is their time to go to the test. So when we turn this upside down, and actually Flowable is using our robots to execute the neutral or the normal cycle, we're going to see huge benefits in the productivity first of all, but also the consistency of how this whole survivorship, the cancer care follow-up, is organized. And we are trying to make sure that everyone with a neutral result, so no action required, will be handled manually. Patients are informed immediately if the result is neutral. We'll let them know that we'll see you next year if that's what they want to do. They don't want to see a physician, so they're good to go. That should be around 75, 80%. And everyone needing further ultrasound or meeting with the clinicians are routed to manual handling. But the 80% of the people are something that we should have fully automated life cycle. And that's the piece that's gonna make a difference. Then if we dig in deeper, I think I touched some of the themes already, but if we really think that how did Flowable help us, that how did we approach the target stage? So as I was explaining, that our company's DNA is in RPA, robotic process automation. Actually happened to me many times that we get client requests that, can you guys do this and this? So more impactful solutions were not possible due to the constraints of pure RPA. Since RPA is mainly for task automation and is super reactive, it couldn't handle anything like that. So this is why Flowable enabled us to do something that's more impactful. This is one of the examples, but I'm very sure we'll talk about more about the future in the end, I believe, is that we can have so many similar transformations with the help of Flowable. That being said, that instead of seeing RPA as the core, so let's start seeing RPA as the executional capability, and Flowable becomes the orchestration, the core, the brains of that we can do so many more powerful and robust things. And the picture here on the right hand side, thanks to our data scientist Rami Luisto and AI, is really illustrating how we see this moving forward. The thing that really RPA falls short is that life isn't always straightforward, especially when it comes to healthcare. We needed something that robust concept of a case, something that will last long. The cancer care could potentially last up to 10 years. And that's definitely something that we were unable to do. This was probably the biggest shortfall we had, that this is not something that we simply cannot do this, and which led to the fact that for many great ideas and client requests, which I had to say thanks, but no thanks. We can't do this today, but today it's possible. This is one example. We have several other examples in healthcare and other domains where we operate. So these things finally are possible. Then the other thing that we were missing, that we didn't really have any good way of having human in the loop. It could be decision making, it could be reporting, it could be many other things. And this is where really the Flowable plus RPA becomes powerful. So we can have human in the loops, taking the decisions they need to as a highly trained clinicians is something that we were really missing. All of this combined, we really believe that there's something very great and meaningful things also in the future that we can grasp together with the capability like what Flowable is providing us with. Then let's look at the projected KPIs. What we're aiming to do. So the first thing is that, as I explained, that in today's state, everyone follows the same kind of follow-up method or a protocol, if you will. As part of this transformation, each and every patient can select between 3 and 4 different ways how they would like to be followed up. The easiest and most likely the most popular way will be that if there's a neutral result, patients just want to be informed. If there's no further action required from them, they just want to know they have no need of meeting anyone virtually or even physically. So that's going to impact the productivity and other KPIs as well. But this is something they can do every year. They can use their digital channels to do that, which is thanks to a lot of this transformation and other KPI improvement we're likely to see. As said, today, everyone should meet a physician, and in many other cases, there are nurses, unit secretaries involved. So the neutral flow should flow as it does, and people actually needing the time will have access to the care. So right now, as I think I explained, the follow-up wait time is somewhere around 9 to 10 months, and the goal is to cut that down where it should be, around a month's time. So people actually who wish to see a physician are able to do so. And that's because of the fact that many patients are independent per se, and then the physicians and nurses have probably 4 to 5 times more to spend working with the patient that actually need it. Something that we're saving time, but also if you think about the quality of the life of the patient. So after the imaging study, so there's always the unknown. They don't know what the result is. Now, what we know we can do is that we can notify the neutral results back to the clients, patients really fast. And that's something is expected to improve the quality of the life of the patient. So they know everything is fine. They know that automatically as soon as the result is available. Something that in today's state could take up to days, if not even weeks. Introduction of something we would call multi-channel interaction, that patient can use digital channels to book their preferred imaging study, test, and time, maybe other things as well as selecting the preferred follow-up method. This is something that doesn't happen today, as I explained, that everyone goes through the same path more or less. Then we are aiming to get to the point, if it's 72 or 80,000 or 60,000, that's another question, that we get the routine tasks automated. As I said, that's our core, that's our bread and butter. And together with Flowable, we can do that differently than before. So we're really seeking an automation rate when it comes to the neutral cases, where we can automate all of the repetitive tasks. And we know we can do it since we've done it elsewhere. So we have these pieces of automations already in production, informing the patients, reading the test results, whatnot. But now for the first time, powered by Flowable, we can actually combine all of this together, and that's what makes this super exciting. Sliding towards the end of the presentation. So as we've really invested heavily in the people with right skills and experience, and what I mean by skills and experience, clinical people with clinical experience. So mainly nurses, but also other disciplines present, that we believe that to get together with Flowable, we can deliver such impactful business outcomes for our health clients and even compete even with the pure EMR vendors. I'm not saying we're going to be an EMR vendor, but I see us developing capabilities, features, if you will, that are actually something that could come from an EMR vendor as well. And that makes us even more relevant going forward into the future. Thing is that time is money, and with Flowable's development capabilities, our clients are actually quite amazed at how quickly we can enable true operational transformation. Unfortunately, due to third-party dependency, this project was a few months delayed, but we can achieve so much in such a little amount of time. And then time is money, so these projects are way more affordable than using a sort of like more traditional system integration approach. As I said, even though we're not quite there operationally, they already asked us that how would you see us augmenting this capability for subsequent expansions? If it's prostate cancer, something else, that's to be seen, but they already see the value. And I guess in the end, and to summarize that we're very excited to see the things that we can achieve with Flowable, and it's actually a challenge for us, myself, our people, our team, that we actually understand the operating environment, the challenges in a way that I'm sure that we can fix this, solve these issues together with Flowable. So that's a challenge for us, that we come up with, we understand the issues, we build solutions that actually help them. So that's a challenge. We are quite sure that Flowable will not be the bottleneck. It can do it. So now it's our job to make sure that we find the untapped value, so to say, and really transform the way of working. One of the last things I want to say that obviously this is a very healthcare consultant-driven exercise, and when this project, like any other project that we work with, goes operational, so this is not where we end. So we of course support these in production, SLA based, and some of our flowable projects, especially in the healthcare, some of them are under 24/7 supervision because they're so business critical, and things, especially in the ED context, it can't wait much longer. So we have 24/7 SLA based maintenance and supervision for these solutions as well. This one is probably not that time critical, but really emphasizing the fact that it's not just consulting what we do, we also support this solution in the production. I think, Fabio, that's end of my presentation. Thank you very much. I'm happy to see if there are any questions, anything that the audience would like me to address. I think we still have a few minutes left for the Q&A.
Yeah, thank you very much, Juha. It was a really exciting presentation, and also after listening the other two, it's great also to see something outside of the financial industry, right? I mean, a really different scenario that we heard today, right? Yeah, in the meanwhile, we also got some questions, so we can work through them. So we can start, I will start just from the top. So I think one of the questions, I think at the beginning, you mentioned customer logos, right? I mean, you show lots of logos, you mentioned customers. Are all of them using Flowable? That's what one.
Yeah, some of them are. As we worked together with you for, I don't recall exactly for how long, but some of them are. We're still in the beginning of the Flowable journey, so to say. But I think contractually, we are making that available for pretty much all of our clients. So we're really hoping to see that they see the benefits of our service offering together with Flowable and how that could elevate their automation journey. Everyone's not there yet, but they will be there in the future. That's what we truly believe.
I like your drive. That's how it should be, right? Yeah. That's great. Cool. I think the other question was around artificial intelligence. I mean, do you see that the artificial intelligence will impact your solution in the future? Like, I mean, the solution you show?
That's an excellent question, actually. I was attending a healthcare seminar yesterday that was all about AI. What we see happening today, this is healthcare related. I'm not sure if it's applicable for other industries, but there are so many companies, even the health providers themselves, they're sort of like developing sort of like standalone AI solutions for different conditions. It could be reading the X-ray image, it could be something else. What's actually missing is the link between the solution and the EMR, really the backbone of the health system that's really driving the patient care, if you will. I really see that this kind of solution in between, this becomes the glue between those several standalone solutions and their EMR system. And that's really how that AI enabled decision making, which is probably the most typical use case. That's how we make sure it's actually used in decision making efficient manner. I'm really sure we're going to see that. For example, reading the X-ray image, so it would be really easy to put that in one of the boxes. So I'm sure it's going to happen, and that's probably an area where we'll see a lot of growth in the future. An excellent question. Thank you for that.
And I think we have a similar question. I mean, not only for your solution, but for the whole healthcare industry, but also it's more a generic question. How does AI impact you for the future? I mean, what are you planning to do with that?
So obviously, as I think I mentioned, our AI data scientist artist, Rami Luisto, leading the healthcare AI team. That's something we do. Obviously, as I explained, there's a lot of development activities for the standalone solution, but they not all of them are now linked to the actually support the way of working. It's just for the decision making support. We're going to see more and more of that, and then we have the whole generative AI conversation ongoing. So how that's going to happen, but in the broader picture, I think what we're doing here together with you as a Flowable. So that's what really glues everything together, support the patient care, because we see a lot of things that are scattered, and something or someone, let that being us, will have to glue that all together, because it's in the end it's all about supporting the patient care, not doing individual AI solutions here and there. So something or someone needs to do that, and let that be us.
Good. And I mean, following up, maybe not on AI, but on the customers. Before you mentioned that, yeah, you have also customers using Flowable outside of the healthcare industry. Do you know what these customers are doing and how they're using Flowable?
I know to some extent, not to the extent that I would be able to very thoroughly explain here. Some of them are more in the transactional heavy operating model, which means that they probably done automation to the maximum extent that they need Flowable kind of capability to orchestrate all of that. Then we have example, ESG is a hot topic. We know that they need Flowable to support that kind of processing. Or then, not probably the most transformative example, but the example from the UK, where we simply needed Flowable together with RPA to glue the two systems together. And this is what I meant with the AI example as well, that we see that a lot of old systems, scattered systems in the healthcare. So there's a really need for a combination of Flowable and RPA, since not everything still supports sort of like robust integration capabilities, if you will.
Cool. Thank you very much. Yeah, I think another question, I mean, we see that the US market is starting to come up. Is your solution, you mentioned before that you're active in the West market, right? Is the solution also implemented in the US market, which you presented?
Not yet, but that's actually something we're hoping. So the best part here is that this solution, this first deployment is based on the leading US EMR system, which is used by, if I say 12 out of best 15 hospitals in the Newsweek list. I don't know if it's 12 or 8, but significant amount. So the best thing is that we can pretty much copy and paste this, and it could be operational. Of course, there's some tweaks, configuration to be done, but since we started with the largest one, it's really easy to implement this elsewhere. So this is not a country-specific, region-specific, condition-specific solution, but this is something that has a really short time to market. If you think about from the patient perspective again, so we can enable our healthcare clients in the US to really reach that transformational state very quickly, since we've already done that. So that's why we have high hopes, both in Finland, but also especially in the US when it comes to the solution. And this is not just about cancer care. It could be many other conditions. If we have in the audience people that work in the healthcare, so I think all of you have already thought about the fact that, wow, this could help with so many things, where the fundament is that the patient condition requires something to happen over a course of that time. And that's where the beauty and the power is, I believe.
Cool. I mean, we are really excited also there to grow also with you in the US. I mean,
yes.
Another question is more about people, which came up, is about what are characteristics of right skills and experience when you invest in people?
Yeah, so if we first think about the project, so we have access, so we are co-creating this with the local university hospital here in the Nordics. So it's the clinical development is led by the chief physician, so person who's also designing the new care pathways, clinical protocols. So that really gives us the clinical knowledge and decision-making ability. Then of course we have a lot of other SMEs, IT support from the client side. Then from our side, we have clinicians. They're mainly, I think they're both nurses associated with this project that have long history with healthcare as a professionals. And then they've also done digital transformation before joining our company. That kind of combination has proven out to be very powerful. These people they know the clinical context. They're at least very reliable and trustworthy in those conversations, and combined with their digital transformations skills, experience, together with everything our company provides, it has proven out to be an excellent decision we made back in the days, that we understood that we need people who know the industry, how healthcare works and what doesn't work. So very happy to have these people with me, and we are heavily growing in here in Finland, in the UK, and especially in the US, investing in people with right skills and experience.
Yeah, and I think a few months back, I even met a lot of them when we did this meeting, right? So it's great to see a lot of domain knowledge.
Yes, and you will meet more of them in the future. I think we recruited one or two more since last time we met.
That's cool. One last question. I think that's a bit like also my personal interest. That's why I picked that one. What are the newest technology trends you see coming in the healthcare industry? We spoke about AI, but is there other things you see that are coming up?
Obviously, we see the healthcare in the context and point of view of what our company provides. So I don't think this is a fully inclusive list of what's going to happen, but listening into yesterday's presentation, so a leading university hospital with very advanced digital capabilities, only thing they're talking about is AI. So that's one big theme. Other things are also the cybersecurity, like protecting the patient data. That's a very big thing, especially since a lot of the organizations are planning, thinking about, or even doing sort of like cloud transformation. So the cloud transformation is probably something that will happen more and more in the future, and that will make our life easier. It will make the AI development easier. So that's one thing. And then the cybersecurity or the data privacy is a topic that is more and more important going into the future. And then if we look very far in the future, like things like quantum computing, enabling probably things that we're not able to calculate today or forecast, but that's probably beyond our operational scope, but that's something that we are likely to see in the future as well.
Cool. Yeah, I mean, we have more questions, but we are unfortunately coming up to the end. I want to thank you very much, Juha, for joining. I mean, it was really great to have you here. I mean, a really interesting story. Looking forward to see more customers coming, how we can collaborate, how we can support you guys. And and for the audience, there is one more exciting session with, I think, Paul Vincent joining soon. So keep posted. Thank you very much.
Thank you.